The Biden administration out with the names of 10 drugs that Medicare will target for price negotiations. These are some blockbuster names, including Eliquis from Bristol-Myers Squibb and Pfizer, and Enbrel by Amgen. Right now, we want to welcome Bertha Coombs, also Chiquita Brooks-LaSure, who is the administrator of the Centers for Medicare and Medicaid Services. Bertha?
Thanks very much, Becky. Madam Administrator, thank you so much for joining us this morning. Certainly a historic day. I'd like to get your thoughts on the process and how did you come up with these 10 drugs?
Well, you said it so well. It is a historic day, and the president has made making health care affordable such a key priority in this administration. We are very excited to make the announcement of the drugs that were selected for negotiation. This is going to be the first time that Medicare is able to negotiate drug prices. The law was very prescriptive about the top 10 drugs that we were going to negotiate in this first round of negotiation. And so we followed the law, which was to look at which are the top spending drugs in the Medicare prescription drug program, which drugs have been on the market for at least 7 years. And we're really excited to announce the drugs that have been selected today.
There are some folks who are wondering about some of the drugs that are on the list and some that are not. Xtandi and Ibrance, those are cancer drugs from Pfizer. Trulicity, a diabetes drug from Lilly. Those are usually seen among the top 10, yet they are not on the list. At the same time, you have a number of diabetes insulin drugs from Novo Nordisk that are.
So I can't speak to other methodologies, but the law was very prescriptive about the time period of the data that we needed to look for. And so we followed the statute in terms of making sure that we were looking at the right years. And so that's really how the list came to be. These are, in fact, from our data, the top spending drugs on the prescription drug side, and they really are going to make such a difference in the lives of the people who take these drugs. So as you're seeing from the list, these are drugs that people typically spend thousands of dollars a year. And thanks to not just negotiation, but other parts of the drug law, people are going to see benefits really starting next year. And in fact, we've already started to see these benefits, whether we're thinking about free vaccines or insulin, which is now capped at $35 for a month's supply if you are in the Medicare program.
Right, and then starting in 2025, we'll see people have a cap on out-of-pocket of $2,000. You made a statement this morning saying that you want to drive down prices for seniors, but at the same time continue to drive competition and innovation. And I've spoken with a number of drug makers this summer who are all very concerned, and they're already starting to think differently about how they develop drugs, because in some senses, they feel that if they're going to have to enter negotiations 10 years in, 10 years in, it shortens their runway. What do you say to their concerns about the fact that this really sort of shortens the amount of time that they can really recoup the investment in innovation?
I would say a couple of things. It's really important that we very much keep an eye on one of our common goals, which is to make sure that people have access to innovative, life-saving treatments. I talk to people all over the country who are making very difficult choices today about whether they will be able to put food on their tables, whether they will be able to pay their rent, or whether they will be able to fill their prescriptions. And it is crucial that we have the tools in our toolbox to make sure that Medicare is sustainable, not just for this generation of seniors, but for millennials, for the next generation, our children's children. And so what I would say is that the drug industry is one of the most innovative in the world. We're seeing some changes that are going to allow Medicare to do what drug companies do every day, which is negotiate with private sector entities for employer-sponsored insurance. Most of our coverage today is negotiation between drug companies and private insurance companies. They do it with the VA. This is a new process, but it is one that is crucial to make sure that people can actually get access to the life-saving drugs that are coming to market.
Yep. Madam Administrator, a lot of these drugs were developed before any of this, obviously, a lot of this happened. And we take a lot of these life-saving treatments for granted. Is there at least the thought that we want to tread lightly on this in terms of our system here in this country? And I think you'd agree abroad over in Europe, they've had basically these are price controls. I know you're saying negotiate, but it's kind of a take it or leave it. There haven't been a lot of these wonder drugs developed in Europe with price controls. Most of them are developed in this country. So it can it can hurt a company's ability to have enough money to innovate if they're not able to recoup their investment. It might be billions of dollars. Do you think about that the future drugs, sure, you can say seniors are going to get the drugs they've already developed, but what if they don't develop anymore, like in Europe? Is there a thought that you don't want to break this system or kill the goose that laid the golden eggs? Do you at least consider that possibility in terms of innovation?
We absolutely are very concerned about making sure that America remains a place where we see innovation. The drug negotiation is very much crafted to think about drugs that have been on the market. So the law is very prescriptive about saying that the drugs that we're going to be negotiating are going to be ones that, first of all, our top spenders are ones that do not have competition and have been on the market for a length of time. My experience is with the Affordable Care Act and really being in Congress and then in the Obama administration. There was a lot of concern about how the Affordable Care Act would change health care. And of course, there were times where there were adjustments. The industry will adjust to a change. But your question of are we being mindful? Absolutely. We want this to be a voluntary back and forth with the industry. Again, very confident that they will be tough negotiators with us. And we will, again, be very mindful of making sure that we are creating and keeping an environment where innovation flurries.